Hello, my name is Rachel Notareschi. Today I'm going to be talking about catheter-associated urinary tract infections, or CAUTIs, and the prevention of them. Introduction. What are CAUTIs? They're considered healthcare-associated infections. These are infections that patients can acquire while obtaining treatment in any healthcare facility. Why does this matter? The CAUTIs lead to many complications such as increased morbidity, mortality, hospital costs, higher hospital costs, patient distress and discomfort, and they increase the length of stay for patients. Yearly, about 1.7 million patients contract healthcare associated infections, and 99,000 of those result in death. And there's also been a change in hospital reimbursement from CAUTIs. So who can help? I would like to focus this video on the nurses and the nursing staff that mainly has hands-on contact with the urinary catheters, but this can also include the advanced practice nurses, the nurse educators, physicians, and executive partners within the hospital. So how do CAUTIs impact healthcare? There's wasteful spending that arises from CAUTIs. Medicare and Medicaid services no longer reimburses hospitals for any patients that contract CAUTIs while they're at the hospital. The average cost of a CAUTI ranges from about $12,000 to $47,000 per CAUTI case. The use of up-to-date practice recommendations aids healthcare providers in providing the best possible patient care, and it has been shown to decrease healthcare costs and improve reimbursement rates. So how do CAUTIs impact the patients? CAUTIs are estimated to result in about 13,000 deaths annually in the United States. 70% of CAUTIs are preventable with the proper use of evidence-based protocols. Patients have shown an average of 4 days of increase of stay when they contract a CAUTI in the hospital. There are some things that can make patients more likely to get a CAUTI, and that's things like the female sex, fecal incontinence, the duration of catheterization, lapses in catheter care protocol. So this is where it is very important that the nursing staff is consistently using evidence-based protocols to decrease the infection rate. And also any active infections that the patient already may have can increase the CAUTI risk as well. So my resolution plan, what's needed, it's basically looking at it in 4 different phases or steps. There needs to be an appropriate placement of the urinary catheters. It can't be for convenience sake. It has to be a medical necessity the patient needs. The use of proper insertion techniques is very important. The nursing staff not only has to stay up to date and educated on what the proper insertion technique is, but they also need to be teaching the new staff about these insertion techniques, and the managers of the floor and nurse educators need to be making sure that this is being done consistently on the floor and in the units. The continuous reassessment for discontinuation. A lot of times the urinary catheters are staying in longer than they actually need to, and they can be taken out a lot sooner. That will decrease the likelihood of the patient getting a CAUTI. And then the proper maintenance of the urinary devices that are in place. So this is cleaning every 8 hours shift, whatever the protocol in the hospital is. So 2 of the protocols or guidelines that have shown really effective in the hospitals that are use them consistently are the nurse-driven removal protocol. This gives the nurse the ability to go in and assess the patient, and they'll have a checklist, and they'll go through each part of the checklist to say, okay, if this has been in for so many days and the patient does not need it anymore, it's not medically necessary for them, we can go ahead and take this catheter out. They don't have to get another order from the doctor. And then the bundle protocols, this is kind of bundling all of your catheter care together, and it also has the use of silver alloy catheters. Securing devices avoids manipulation of the urinary catheter that can expose the patients to germs, and then avoiding contact with the floor of the bag. And that is my presentation. Thank you guys.